Hi everyone, I'm Noorhazamin Binti Hamid, matrix number 8305310251980001 from the course Bachelor of Nursing Science with Honours, branch OUMH1303. This assignment is done to fulfill a requirement for course OUMH1303 English for Oral Communication. Today, I'm going to deliver an interesting informative topic about public education on hands-only CPR. The purpose I choose this topic is to create public awareness on simple and easy life-saving maneuver technique to save cardiac arrest victims. Public education on hands-only CPR is vital because everyone can save a life. Before we go further, let's see what is the heart. The heart is a hollow muscular organ which acts as a pump, and it is an incredible machine which can beat for average of 70 times per minute and about 100,000 times for human being in each day, which is 36 million a year and up to 3 billion times in our lifetime. What if something goes wrong with our heart? Who will get cardiac arrest? Is it true that only old age people will get cardiac arrest? The answer is no. Most of the people, whether old or young age, is at risk of getting cardiac arrest. Like some of our famous people and artists in Malaysia who died at the early age due to cardiac arrest, such as Ashraf Sinclair, Faizal Yusuf and Hani Mohsin. So, are we prepared for sudden cardiac arrest? Who will save us or who will save our loved ones? Cardiac arrest occurred due to many causes, but the main cause that distribute to cardiac arrest in Malaysia is heart attack. Other causes such as drowning, choking, trauma, electrical shock, poisoning, allergic reaction and stroke may also lead to cardiac arrest. Cardiac arrest is triggered by an electrical malfunction in the heart that causes an irregular heartbeat, which is called arrhythmia. So when the normal heartbeat like look-dook, but our abnormal heart will beats like do-do-do-do-do-do. So when our loved ones having heart attack, which may lead to cardiac arrest, do we make healthy decision to save a person's life by doing CPR? Or do we ourselves educate others around us how to do proper CPR to save someone else's life someday? In Mr. Bean movie, on how he saves a life by using chest compression by using his leg. Is it the right way to do CPR? No. That is the wrong method, but he is able to save someone's life due to doing chest compression. So what CPR does stand for? C is for cardio, which means our heart. P is for our lungs. And resuscitation means we restarted back the system of cardiac and our lungs. What is CPR? CPR is a life-saving technique useful in many emergencies including heart attack and near drowning in which someone's breathing and heartbeat has stopped. The American Heart Association recommends that everyone, untrained or trained, bystanders and medical personnel alike begin CPR with the chest compression. By performing CPR at the moment the heart stops, it will help to increase the chance of survival for the victims. Why time is critical? Every 0 minute that pass by, the survival rate will drop. And by the 6 to 10 minutes the brain has stopped receiving oxygen, the brain damage will happen and there is no way to reverse back the brain function. The purpose of doing CPR is with 3 principles of 3P. The first P is to preserve life, and the second P is to prevent worsening of the victim's condition, and the last P is to promote recovery of the victims. Doing CPR according to American Heart Association suggestion consists of 3 vital core, which is CAB. C is to reverse victim circulations by restoring blood circulation with doing chest compression. A is opening airway so that the airway of a victim is clear. And B is to help victim to breathe by using mouth-to-mouth breathing technique. But unfortunately, in this new pandemic COVID-19 era, the American Heart Association has come up with the new steps of doing CPR safely without risking our lives with the COVID-19 pandemic. The first step is to call for help. And the second step, you have to reach for mask or cloth to cover your mouth and nose and also victim mouth and nose. The third step is to start doing chest compression, and finally, the help will arrive and you will save the life by bringing to the closest hospital as soon as possible. So, what's the difference between CPR routinely that we perform with hands-only CPR? Hands-only CPR with just a chest compression has been proven as effective as CPR with breath in treating cardiac arrest patients. But sadly, only 32% of cardiac arrest victims will get CPR from bystanders, while the rest just wait for the ambulance to arrive, which may take very long time. So what is hands-only CPR? Hands-only CPR is a skill without mouth-to-mouth rescue breath. It is recommended to use by a layman who found victim collapsed outside healthcare facilities. It consists of two main steps, which is number one is to call for help, 999, and to push hard and fast in the center of the chest with the chest compression technique. So now we go further on how to perform hands-only CPR step by steps. Now I'm going to demonstrate to you step by step on how to perform correct hands-on CPR. The step that you should perform is verify scene for safety. Remove victim away from danger, bring victim to the safer place, place victim in the hard and flat surface. Start with checking for victim's response by tapping on both shoulders. Sir, are you okay? If there is no response, shout for help. Next, you should assess for victim's breathing by looking at the chest movement for not more than 10 seconds. If there is no breathing, you may start the chest compression. So how to do chest compression? You must place both of your hands on top of the center of the chest. Lock your elbow and ensure shoulder and elbow is straight. Push hard and fast at the center of the chest at the rate of 100 to 120 per minute. The depth of the compression must be 5 to 6 cm or 2 to 2.5 inches depth. Allow chest to recoil. 1 and 2 and 3 and 4 and 5, 6, 7, 8, 9, 10. And continue doing this chest compression until help is arrived. Chest compression until help is arrived or someone else taking over your chest compression. Remember, by pushing hard and fast at a depth of 5 to 6 cm or 2 till 2.5 inches depth, you will allow the oxygen to be pumped back to all over organ, including the brain. Now you have learned the proper way of doing CPR. Until when you want to stop doing CPR? CPR should be continued until these reasons. And to stop CPR are when the scene becomes unsafe and you need to evacuate the victims to a safer place, or you have detected signs of circulation, which means victim has regained consciousness and breathing, or an AED has arrived, which means an emergency medical system response team has finally arrived at the scene to take over from you, or you are too exhausted to continue doing CPR and another person has come over to take over from you. So remember, hands-only CPR has been shown to be effective for cardiac arrest victim, and if you are doing nothing to save victim, you may lose the victim forever. It can double or even triple the victim's chance of survival by doing early chest compression. So, as a conclusion, I want to emphasize on 4 components of hands-only CPR, which is number 1, push hard and fast in the center of the chest at the rate of 100 to 120 beats per minute, like in song of Staying Alive. Number 2, compression rate must be 2 to 2.5 inches or 5 to 6 centimeter depth. And number 3, promote full chest to recoil. And number 4, minimize interruption and remains doing chest compression. So remember, just compress hard and fast like the disco beat. Do not stop until help has arrived. Thank you for watching my speech.